Hi Nisha, how are you?
Good, thank you.
How are you doing now?
Much better.
Okay, well that's great to hear. I'm going to start by assessing your eyes, ears, nose, and throat. Is that okay with you?
Yes.
Okay, good. So first thing we're going to do is I'm going to give you this piece of paper and you're going to cover both sides of your eyes with it. And I'm going to be checking your cranial nerve too. And this is going to be checking your vision of field confrontation.
Okay.
So go ahead and hold that in your right. Good. Now the other side. Okay, great. Okay, let me take that from you. Now the next thing I'm going to be checking, it's another way to assess your extraocular muscle function. And I'm going to, this light. I'm going to flash this in the middle of your eyebrows and you're going to look at it. Good. One more time. Okay, great. So while I was doing that, that was checking your extraocular muscle function of your eyes. And now I'm going to be checking for parallel traction, assessing for cardinal position of gaze with the pen. And I want you to just follow this pen, okay?
Okay.
Okay, that was really good. You did excellent. That checked your cranial nerve 3, 4, and 6, which are functioning great. Now I'm going to be checking your pupil size. Go ahead and, okay, I'm checking your pupil size, the shape. Good. And the quality. And now I'm going to check to see how the corneal reflexes. I don't know what's wrong with the light. Okay, here we go. Sorry about that. Okay, just look at me. Good. Okay.
It's bright.
Yeah, I'm gonna check that one more time. I didn't get to see the pupil reaction of one of the eyes. Good. Okay, good. So while I was checking that, both pupils were reacting briskly, which is normal. So that's good. Now the next thing we're gonna check is with the pen. This is gonna check for accommodation. Okay, so I want you to look at the cabinet to your left. Okay, look at the pen now. You can keep your face straight. Just look at the pen and then look at the cabinet next to you. Good. Now look at your other side. Look at the pen. Good. So that was checking for accommodation, which is good. Now the next test I'm going to do is check your ears. No, we did this last time too, but this time I'm checking your ears, looking at the position, alignment, the skin tone, which is great. And I'm also, if I had an otoscope which checks inside the ear, I would be checking inside the ear, and I'm going to just do it with the flashlight. And for adults, I have to lift the pinna up and back. Your auditory meatus looks good. Let me see this side. And that looks good as well. And also your tympanic membrane at the end, which is also known as the eardrum, that looks very good. It's usually clear with a grayish color and it looks normal. And there's no lesions. I didn't notice any discharge, no redness. And these are your auricles, and they're movable, which is good. And your tragus, I'm checking to see if there's any tenderness. And I don't feel any. Okay, the next test we're going to do is the voice test. So I'm going to whisper a few letters in your ear, and I just want you to say it back to me, okay?
C. L.
Good. Now we're going to do this side.
N. C.
Okay, good. You did really good. Okay, so that was the voice test that we did. The next test I'm going to do is I'm going to be checking your nose, and I'm going to look at the symmetry of the nose, which looks really good. And I'm looking for any lesions, any redness, swelling. Do you have any pain here?
Nope.
Okay, good. Now I'm going to be checking the inside of your nose. Check for any deviated septum or any discharge. I don't notice any nasal mucosa or dryness or any turbinates, which is good. I didn't notice any of that. And if I can have you close one of your nostrils and breathe through the other one. Good. Now the other side. Okay, great. I was checking to make sure that your ears were open, which they are, so that's good. Now the next test is I'm going to be checking inside your mouth. And if you can open your mouth for me. Good. I'm looking at your teeth, your gums, your floor of your mouth. Lift your tongue up. Good. Okay, that looks really good. Your uvula looks good. Your palates up on the top look really good. And let me see. Look at your tonsils. Stick out your tongue for me. Good. Your tonsils look much better from last time. Okay, and can you stick out your tongue and say ah again? Okay, good. Now, while you were saying ah, I was seeing your uvula move, which is checking your cranial nerve 9 and 10. So, which is good, it's working.
Okay.
And also, if you can stick out your tongue for me. Okay, that's great. And sticking out your tongue, that's checking your cranial nerve 12, which is good. And now I'm just gonna put my gloves on and just feel inside your mouth. I'm just gonna palpate the inside of the mouth to see if I feel any lesions or anything abnormal. If you can open your mouth, good. If there's any pain that you might notice, just let me know. Good, all looks good. I don't see any redness. Alright, this looks good. Let me see. Lift up your tongue. Okay, good. Alright, your mouth looks great and your lips look good. No dryness or any cracks. That's great. Okay, Nisha, that was end of the assessment. So everything looks great. I'm glad you're doing really good. And the doctor will come in and do further evaluation, okay?
Thank you so
Very
much.
nice to see you again.
Yes, you
All
too.
right, take care.